This is the Mechanical Care Forum, episode 393, and it's season 13, and we're highlighting the McKenzie Institute International's Diploma program. Join me today with Julie, Adam, and Paco, three recent graduates successfully attaining this diploma status. We'll hear their story, their journey through the program, how they're using this knowledge, and opportunities which have emerged. This and more this week on MCF. Hey, everyone, and welcome back. Thanks for joining us today as we continue to explore the McKenzie Institute International's Diploma program. I'm very pleased and excited to share that this episode is brought to you by the McKenzie Institute International. The McKenzie method of mechanical diagnosis and therapy is globally recognized as a leading treatment for back, neck, and extremity disorders. Personally, MDT has made the single greatest positive influence on my practice, hands down. The McKenzie Institute International offers this diploma program to those professionals who have achieved prior certification in the method. If you're interested in learning more, here are two ways you can. Stay tuned today and be sure to follow us all through this season, season 13, as we highlight this year's cohort of students through the program and get perspectives from this year's group, as well as from some of the instructors and from some of the clinical tutors on their clinical residencies and more. And secondly, be sure to go to the website to learn more about the program and how to apply. You'll find that by clicking on the Education tab and scrolling down to International Diploma. Just go to mckenzieinstitute.org. Okay, so let's get to it. We're continuing today with a discussion with Julie from Denmark, Paco from France, and Adam from the US. These three recent graduates share their clinical background, their perspectives of why they wanted to pursue this program, how they've seen it impact their patient care, and some opportunities which they believe have come from this accomplishment. Stay with us through to the end to hear what's in store for following episodes. So here we go. Julie, Paco, and Adam. Enjoy. With us today for the Mechanical Care Forum for an episode to highlight three recent graduates from the McKenzie Institute International's Diploma program. We have Julie, Paco, and Adam. Guys, thanks so much for joining us today. Welcome to the podcast.
Thank you.
Thank you for having us.
Excellent. So I'll just give you guys first a moment to introduce yourself, just to give the listeners a bit of an understanding of who you are and where you are and what you do. Julie, would you like to start?
Sure. My name is Julie. I'm from Denmark, Northern Jutland to be more exact. I finished my diploma December last year, 22. So I'm very new diploma, but liking it so far.
Excellent. And what kind of setting are you in clinically?
I'm in a private clinic, always been private clinic. So manual therapist, inpatients, yeah.
Okay, absolutely, yeah. Paco, share with us a little bit about yourself, where you are and what you do.
Okay, so my name is Paco. I'm French and I live in a little town called Paris. I graduated in 2002 and got my McKenzie certification in 2016. And actually I passed the diploma exam in December 2022. So also recently graduated. I work in a private practice as well. Actually, I manage with my 4 business partners 2 clinics in the center of Paris. And we are 16 physical therapists in total with 4 diplomates, including 1 instructor, Jean-Philippe Deneville, and then 9 credential, including 1 who is also doing the diploma program. I think he finished the theoretical part last year. He's going to the clinical part this summer. And so, yeah, I'm working with a lot of McKenzie practitioners and the high level of practice. So it's really interesting to share our knowledge, experiences, and also share our patients. So that's really, really interesting. We only do musculoskeletal issues, and we're also specialized in sport injuries. And in addition to that, I'm also an instructor assistant for the McKenzie courses. So I do about 5 to 10 courses per year. So I'm doing both.
Yeah.
That's it.
Excellent. Get your hands deep within this MDT stuff, I can see.
Yeah.
That's great. Adam, share with us a little bit about where you are, what you do, and your setting.
Yeah, I'm in Chicago, Illinois, right by where the Cubs play. I am in private practice like Julie, and Paco, where, you see a wide range of patients. I like to say derangement doesn't discriminate. It's kind of the whole population base. And I've been taking the McKenzie courses since I was in chiropractic school. Started my journey in about end of 2014, beginning of 2015. Became credentialed in 2016. And then just recently became Diploma in January of this year, 2023.
Fresh out of it. Excellent. Yeah,
Mm-hmm.
good. Yeah, thank you guys for having an interest to share just your perspective. And we're doing a series that you guys are a bit aware of, where we're highlighting my cohort, the cohort that I'm in right now in the theoretical. We're, I think, in week 8 right now. So I just got through making some comments on the discussions. You guys remember those days?
Oh, yeah.
And we're going to highlight some of the instructors and some that are in charge of the program. But I also wanted to get your perspective. Can you guys just think back to before you started the theoretical and you were applying for the program? What was the motivation behind your interest to go through this significant effort, to the time and the financial commitments and all? What was it about your practice? Who were you talking with? Who was an influence on you to consider going through and trying to achieve this status of diploma level? Julie, why don't you share with us anything that comes to your mind when I ask that question?
Well, one question, there was a lot of questions. No, my entire McKenzie journey started with my first boss, who was certified McKenzie, and he thought, well, you're newly educated back in 2010. You should get some tools to diagnose patients. And I was so skeptical because my little knowledge about McKenzie was, oh, you just have to do back extensions. So why should I bother taking these courses? But I started doing them and I got my credential in 2013. And I was like, this can do something. This is actually pretty good. But then I stopped and I was like, there must be more out there. So I did a whole lot of manual therapy and dug into some other courses and methods. And then back in, I think it was 19, my current boss, he was like, have you ever thought about the diploma? I was like, no way. I just have 2 small kids. I'm working my butt off. How in the world I'm going to have time for this? And he said, you know what? You've come to a level where you need to be better. I was like, okay, then I'm going to be better. I'm going to do the diploma to see if I can get a greater knowledge of diagnosing people, get better at diagnosing people and faster. So I looked into it and I asked other Danish diplomas, how did they do it? How could it be done with a family? Could it be done by working on the side? And they all were very supportive and basically took me through it. Like when you have the theoretical week, if it's possible you to reduce your working time, then it's almost easy to do. And basically you just have to really plan around it. But it's doable. But I would say as a mom for 2 young kids, it's hard. It's hard work. But I would do it again.
Yes. Okay. All right. So what were your hesitations initially? Was it just the time factor with having a family? Was it the financial piece? Was it a combination of several things?
No, I'm very lucky. My boss paid for everything. He paid for my time off, my education, everything I needed, he gave it to me. So it was more the time because I had to take care of my job. I supervised students at my clinic, and I was worried about that there was not enough time in the day for me to do a good job because I didn't want to just hustle through. I actually wanted to learn something. So it was the time aspect that made me hesitant in the start. But the other Danish diplomas, they convinced me. And I thought, okay, I'll give it a try, see what happens.
Okay, excellent. And you hinted about it briefly, that you stopped the McKenzie for a while and you went and chased maybe some other courses thinking there's got to be maybe some better ways out there. And so do you care to share? You don't have to mention them necessarily by name. You can if you wish, but what were you learning from outside the MDT? And then why did that still leave you with a thought that I could do better, or I need to learn more?
A lot of the other courses I did a lot of mulligan, acupuncture, and other manual treatment skills. But I didn't find one that was a better diagnostic method than the McKenzie. There's so many different ways of treating a patient, hands on, hands off, training, whatever. There's so many options. But if you can't diagnose your patient right, all your treatment skills is out the window. So using the McKenzie method and using the history sheet where we diagnose them, it was just the most obvious way of diagnosing a patient. And that's why I always came back to using the McKenzie method in diagnosing, but I actually used different variants of treatment. So I use a lot of mulligan for treatment, and still use McKenzie for diagnosing.
Mm-hmm. Yeah. Very good. Thanks for sharing that. Paco, tell us a little bit about your experience beforehand. What was that motivating piece? Who was in your ear? Like Julie just mentioned, she had. Tell us a little bit about what were the motivating pieces and how did you feel inadequate or just that you needed to study more?
Well, I think I've been graduated 20 years ago, and here in France, actually at this time, we didn't really know evidence-based practice. Like evidence-based practice arrived in France less than 10 years ago. So when I finished my studies, the only real postgraduate education would be something like osteopathy, like very manual and things like this. But I wasn't really involved that much in physiotherapy at this time. I was more like doing replacement everywhere as in different private practice and traveling a lot. I did also some other things, like I traveled for the first 15 years almost. So I wasn't that much involved in my job. It was more like helping me to travel. But then afterwards, I wanted to settle down, and I had this opportunity to work in Paris with some of my colleagues who just opened this new clinic. And so when I settled down, like I already did like part A and B, I think, before. But I saw that the McKenzie approach was really interesting because it was completely different to whatever I saw before. Like I remember when I was doing some manual therapy or osteopathic stuff, I was really frustrated because I wasn't sure that I was feeling what I was supposed to feel with my hands. You know what I mean? And there was not a real diagnosis behind that. And also, when a patient sometimes had the impression that my session was really bad and the patient would get better, and I didn't know why. And in the opposite, I had the impression that nothing was working and the patient was improving. And so I was a bit like frustrated by that, you know, not to have this ability to know what I had to do and why I was doing things and how I could interpret the results. So when I settled down, as I told you, I'm working with a lot of McKenzie practitioners, so it really pushed me up to the certification. And after that, I was thinking the diploma is like climbing the Everest, you know, like all the process and seemed to be very, very long. But because I was really motivated by my colleagues and also exchanging with the other instructor, because I had this opportunity to assist the instructor during the courses. So it gives me more and more willing to do the diploma because I was also interested in teaching. I'd love to teach MDT. So I knew that it was necessary to get the diploma to become an instructor. And I also have been very involved also in the, how you say, volunteering in the association. In France, we have a McKenzie Practitioner Association, and I've been really involved in this association. I helped a lot to organize congresses. So I had the opportunity also to meet many McKenzie instructors from overseas, like Richard, Helen, and also Mark Miller, Mark Leslett, and well, so all this energy, all those people that are very passionate, give me even more passion and willing to do the whole diploma program. Yes. So that's why at the end I decided, yeah, I can do it because I also had some colleagues who were doing it. I saw that it was manageable, at the end.
Okay. Yeah. Yeah. Adam, similar thoughts and situations from your perspective, or what was your story?
Yeah, to kind of echo on what both these fine clinicians have said, my motivation was my patients. I saw that there was a need to be better for them to continue. It's like you take a part A and you start playing around with some of the repeated test movements and you're seeing how they're responding to it. And you see a derangement in your clinic, and all of a sudden it's like you see the magic so much happen and you get excited. And then all of a sudden you start playing around with the extremities as you get through part C and D, and you're like, wow, there's got to be something better. And I'm still very, well, I try and be athletic. I would say I'm a weekend warrior. Last year I did a 50K. So I'm always doing certain things to my body to kind of hurt my body. And McKenzie makes it a perfect and beautiful self-assessment to know whether or not I can push and work through things. I'm actually right now rehabbing a back injury, and I'm using the principles of McKenzie to help get myself through it. Even right now, as I sit here, I have my lumbar roll behind my back. But yeah, so it was a passion to want to be better for my patients, maybe a selfish one to be better for myself. But I was inspired by a couple of mentors. Dr. Hefner was the first instructor that I had when I was taking courses through the chiropractic division.
I'm really sorry to hear that, Adam, by the way. Yeah, sorry about that.
I can hear him right now echoing in me.
Yeah.
He's a great mentor, great leader. I also had the privilege of working with him with a company called Align Modern Health in Chicago, which he is still part of. And then I worked with Scott Herbawi. I've taken a number of courses with Scott Herbawi. And then I had the privilege of, he was my clinical educator down in Austin, Texas. And it was amazing to see the patterns that he sees like ahead of time. He takes a history and he already knows where he's going. And I think that was like when the curtain kind of got pulled back, kind of like the Oz curtain, and you're seeing these things and you know that, okay, it's a derangement. Let's try and work with this. Or okay, maybe it's not. Maybe we need to load this and see if there's, some type of contractile dysfunction we're ruling out in the extremities or, things like that. And it's just amazing to see these patterns and how different clinicians work with this. I've also had the privilege of being able to work in kind of a limited capacity with Mark Miller through the IMC. And again, seeing clinical patterns, how they approach it, you know what I mean? And what I think the McKenzie Institute is always trying to educate people with is that it's a thought process, you know what I mean? And it's not how one clinician treats one patient. It's not you're going to be the exact same way. And it's very interesting to see those differences. But the biggest part that they want is, they want that patient education and building that relationship, because I've seen that has helped patients get past, their barriers more so than anything, instead of allowing them to get back into that same medical loop. If they trust you and they feel like you're just as invested in the treatment plan with them, they're going to give you more in trying to get better. And I've always thought that was unique. So yeah, that was a long roundabout way of getting there, but yeah.
Yeah, excellent. So you guys may have experienced that when you were certified, you thought, I got this now down pat. I know MDT, I can do MDT, with the best of them. And then you realize and you start to know what you don't know originally. Did you guys have that same thought process, Julie? Did you have that where you thought you knew it pretty well and then you realized later that you didn't through the diploma program?
Yeah, when I was certified, I was like, sure, got it down. Nothing can shake me now. I got this diagnostic thing. Yeah, I know what I'm doing. And I kept shaking through. Every time I had a patient, I was like, oh, this could be a derangement. It could be a dysfunction. Maybe it's the derangement. No, yeah. So I knew nothing, basically knew nothing. Started the diploma and really digging down into it and learning to trust the diagnostic path. That was so hard. But as soon as I started trusting it, it became so much easier. I'm not wailing back and forth anymore, but really, really had to trust it. And that was hard. I found that actually pretty difficult.
Julie, did you see yourself for that clarity to start improving during the theoretical? Was it between when you were in the clinic before having gone to the practicum, or was it during the practicum, or was it just an evolution through it all?
Week 3.
Week 3.
in the week 3, when you have tendon loading,
Yeah.
it basically blew my mind. Jill Cook and Ebony Rio, all their theories about how to load tendons. I was like, okay, when you put that into perspective, it makes sense. Loading. So it makes it so much easier to search out if you're looking, or if it looks like a derangement, what happens if we load it? What happens if we don't load it? It made it easier diagnosing patients. So week 3.
Yeah. Julie, are you saying to me that before you might have been jumping to treatment, and maybe after week 3, yes, you're maybe doing the same thing, but your thought process as to why you're doing it is more from that refuting or confirming what your hypothesis is?
Yeah, I was jumping the gun a bit before, moving on too fast. And I just kind of understood the deeper meaning after week 3. It sounds so holy when I'm saying it out loud, I know. But it gave me an ease to be more curious instead of being nervous and being annoyed that I couldn't figure this problem out. I became more curious. What happens if I load this patient? Oh, they get better. Cool. Then it must be in this category. So it helped me be a little bit more specific. It helped me think through more practical, and to put them in the right box.
Yeah.
The patients in the right box.
Yeah. Paco, similar experience in yours? Was it week 3, or when was it that it started to click, or was it gradual that you don't have an exact date or a week?
I don't think I have like an exact day or week like Julie. I think it will be like a progressive process. I think my main issue before doing the diploma was that I wasn't able to rule out the derangement. You know what I mean? I mean, like I could spend like several sessions, too many sessions, like looking for the little derangement, you know, like the little thing that I could have missed, and make that wouldn't give the best opportunity for the patient to recover. And I think one of the things that helped me more during the diploma was to go faster. Also in the progression of forces, for example, I could more easily know how faster I can go, you know, and also taking more into account all the elements of the interview, you know, more than only just the physical exam.
Okay.
So I remember maybe like I would say, I don't remember which week was, but probably one of the last one. We had this course with Fiona McKenzie and I don't remember his name, David.
David.
Yes, and it was more about case reports of case studies, and one of the exercise was to rule out all the McKenzie syndrome, but also the other category at the end of the interview. And so then I started to really think of all the other subcategories from the beginning of the session. And it made me way more easy because there were some I could rule out, and there were some that were so obvious that it really reduced the probability that it would be a derangement. You know what I mean? And at the end, for me, was the most interesting during the diploma, well, at the end of the diploma, is to be able to take all the other category into account from the beginning. And that's also why I think at the end that when we do the credential part, we're really focused on the McKenzie syndrome. And at the end, McKenzie syndrome, like contractile dysfunction is tendinopathy. So we should be able to diagnose them only with our previous education, you know. The dysfunction is just like, it's stiff, but the derangement is the real McKenzie specific stuff, I would say. And so we are so much focused on that we forgot all the rest. And for me, the most interesting thing with the McKenzie approach is its comprehensiveness, including all the other categories. And when we did like this week, I think it was week 8, 7 or 8, something like this. And at this time, I started really like to use the whole thing, the whole clinical rhythm.
Yes. Yeah. Adam, think back to yours. Was it in the theoretical? Was it in the practicum? And maybe depending, when was it? What was it that clicked? You've heard Paco and Julie both have that kind of moment with David and Fiona for Paco and with the tendinopathy for Julie. What about for you?
So I think the theoretical sets the table for your practical, learning. And I remember it was probably because I broke the practical portion down in Austin up into 2 sessions, but it was within like the first week when Scott first set me down and we started kind of doing some of the drilling of like going through some of the things that you should know and be caught up to speed. And I was like, all right, it's like you can know all these things in a theoretical portion, but when you have to literally pull from and think on your feet in front of the patient and be able to put those things together, that's when the sheet is a beautiful learning tool. And Scott sat down and he circled certain parts of it and he's like, okay, what are we learning here? When does safety first become, an issue, and he's just going through his thought process. I was like, this man should be literally, teaching clinicians everywhere. You know what I mean? We should expand this because your thought process is just so much more empowered than when you're looking at this. You're not worried about treating, some of the red flag stuff if you're looking at it like this, or exactly what to do and manage these cases. And I think it was then it hit me like a freight train that first week down there. And I was like, okay, it's time to step it back up. And he kept a passion, of learning in me because I could see he was passionate about teaching it. And so that was the big thing for me. I think I remember when we first got to the tendon loading, Julie, that I was like, holy cow, I love listening to these women. I would go on YouTube and listen to their talks that were available and things like that. And I was like, this is genius. And it was the wealth of knowledge that the theoretical put to you. And I just think it's excellent that then you get to go and use all that. That sets the table. And then you get to go and build on that and learn that, because working from a book and then doing what you need to do, the magic in front of a patient, is completely different. And I think that was when it all kind of clicked for me when I was down there.
Mm-hmm. Sometimes, guys, we have past patients that we think of. Oh, I treated this patient before I went to the diploma program. Julie, you're putting your face in your hands. So I know this is striking too close to home, but do you guys remember some of those patients and think, I wish I could go back and handle that again? Julie, what are your thoughts?
I'm mainly thinking back when I was first educated as a physio, and holy moly, I've done not great, really not great. Well, I've listened to the patient, I've met the patient, I've seen the patient, but I've done some weird shit, to be honest. I'm sorry. And now I know better, but it doesn't change anything. It's a learning progress. We need experience as well, and we need to see all these thousands of patients before we become better. But wow, they paid money to. Oh, it's so bad, but they're all good. Nobody got hurt. It just took way longer than it was supposed to, but everybody's great.
Paco, do you look back as well? I mean, you're from a little bit different setting, I guess, because you met people that were in this camp of clinical reasoning. So maybe yours wasn't as stark of a contrast as Julie.
I also remember what I did before working in the clinical practice where I work now. But I think I don't feel like that guilty because I was really involved in rehabilitation. That was more like, I say, like a way to travel. But I don't remember one exact patient. But as Julie say, like, I think it was part of my own education, my own process. We obviously, well, I hope we are better practitioners, but better now therapists now than what we used to be like 10 years ago. And because we learn also from experience, and as we are, I think all of us like very passionate, then we learn every day from the people we work with. and from the courses we follow and stuff. So the patients we have. So yeah, I think, and I think I will be better in a few years too.
Yeah. Sometimes I've heard people who've gone through the diploma program talk about the one patient on the practicum that really they think back. Do you guys have a patient in your mind right now, as I say that you remember on the practicum? Or was it just, sitting down with the instructor and kind of just going over principles? Or was there one that stands out? Anyone?
Well, personally, I have one patient I remember, like, it was quite easy. Was this guy had like a derangement, but it was like derangement that was responding in extension. Everything was going pretty good. And then he plateaued. And he had a lateral pain on the left leg. And he recovered all his extension and also the lateral glide. And I wasn't understanding, like, what can I do more? And we did only extension in line. And I checked him again, and I checked his extension in standing, and then it was restricted. And at this time, I said, okay, let's try to do that. Like, he was already 70% better, but they were like, this 30% that couldn't really improve. And then we started doing extension in standing, and then it just recovered completely. And it changed like, okay, before I would have done like all the different like side gliding, flexion, rotation, and whatever, but I would never like take this time to just think of it. Okay, so his extension is fully recovered in discharge, but not in charge. So let's do it loading. And as Julie said, the way you manage to unload loading also like makes a big difference. Clinical part was interesting also to improve my skills as a McKenzie practitioner, like really like for the derangement.
Yeah. So that plateauing, when patients plateau or come back and they're actually starting to worsen, doesn't stump you as much as it used to. Is that what I'm hearing?
Yeah. When it's already 70% better, you have to look a bit like thoroughly. And is 70% better with extension? Why should you look for something else? Just find another way to do extension. And the 30% left would be better, because this guy didn't have any, I would say, like psychosocial issue. He didn't have any yellow flags and stuff like this. He was like doing his exercises well and understanding everything. There was no other reason to plateau, like it was really mechanical. And that helped me a lot to then know when it's really mechanical and when something else could also influence.
Okay. Yeah, you just needed to give an alternative load. Yeah, Julie, you raised your hand. Do you have a patient? Share it with us.
Yeah, I divided my clinical into 3 parts. So I went 3 weeks abroad, and then I went home to my own clinic, see patients. And I saw a patient with thoracic pain and went through the exam sheet, and we really focused on in the clinic before serious pathology. You need to ask those questions, and you need to ask all of them and make sure that you actually get an answer and not just assume. So I was like, okay, I'm going to run through these questions, really going to get an answer. And something just didn't add up. And I was a little bit worried about this guy. And I sent him to the doctor, and he had bone cancer in the thoracic spine. So it actually helped me a lot. I used to run over those questions before. Just nobody has serious pathology. Jesus. But they actually do. And they won't tell you unless you ask them. Has there been any sleep problems, weight loss, tired, pain, anything? You really need to really ask them and make sure that you get an answer and not just a vague answer. So that was an eye-opener for me. So I never, ever skip those questions with any patients. Even though they look fine, they look healthy, they act healthy, you never know unless you really ask them. Has there been a previous history of cancer, for example? So that was really an eye-opener for me.
Yeah, good. So we're always thinking, okay, what's this achievement going to accomplish for me? And you guys had specific goals. Sounds like they were mostly encouraged by your employer or the people that you're working with to just refine your skills and improve them, your diagnostic capabilities. But sometimes we have opportunities that come our way once we've met a certain achievement like this that we didn't even think of. Have you guys had any opportunities that have come out of this that you were hoping to achieve, or that you were going to hope to have opportunity to do, or some that you weren't even thinking about? Anyone can think anything just in their practice that has given them some opportunities by having gone through the diploma program?
A couple of opportunities that have arrived or developed is being a clinical mentor for students. I am adjunct faculty at a couple of the chiropractic colleges, and some students have sought me out because of the McKenzie training so they can continue to keep learning. And even though I've just finished the diploma program in early January, it's a goal of mine to also look and give back and possibly get the teaching going back for the chiropractic division in the United States. So I think that should be a big thing that we're looking towards here, because I feel like that's a huge educational piece that my colleagues in the chiropractic world are kind of missing. Right now they can always take the physical therapy classes and stuff like that, but it's a greater motivator when they can get the continuing education benefits and things like that don't transfer over per license. So it's interesting.
Mm-hmm. Yeah. And even maybe that you haven't achieved yet, or the opportunity hasn't come your way yet, but your mind is open to, you know what, I may want to use the knowledge and the skills and the clinical reasoning that I've gained through the diploma program to go this direction, or look in this patient population that I wasn't thinking of. Julie or Paco, any outlook on the future that has maybe been influenced by having gone through the diploma program?
No, I really want to go further ahead. I want to go back to the physio school and teach. We have a very weak back semester. I don't even call it a semester, it's 2 weeks. And I see the new students or the new physios, when they come out, they know nothing about the back or the neck or the pelvic area. And they only think that you can treat extremities by training or taping or laser. So I want to go back to the school and teach some more. I get students at my clinic, I teach them, but I want to teach and share the little knowledge I've gotten from the diploma.
Yeah. Sounds like a common thread between the three of you that you have. If you had to go back and tell yourself a few years ago some advice related to should you go through the diploma program, or when, or how to approach it, or what to do to prepare for it, what would you tell yourself, Adam?
I would tell myself that it was difficult because when I took the diploma program, it was kind of at a perfect time in my life. Because of where I was at in my life, I could have moved it up sooner, but I would have highly, highly encouraged people who are on the fence about doing it to really look into it. Because like we talked about earlier, when you first, become credentialed, it's like you climb this small little mountain peak and you get to the summit and you look around and you're like, okay, I have an understanding. And then you all of a sudden look up at the people who have been doing it for many, many years. And you're like, holy cow, there's so much more I have to give and offer. Let's continue. And when you kind of dive into it and you see it's amazing that you can get so much better at your clinical reasoning in such a short amount of time, surrounding yourself with like-minded clinicians. And one of the cool things that I think the diploma program also affords is it offers a network for you to continue to keep, in contact with a lot of the other diplomaed physicians, in your area or globally. And there's continual learning. And that's what I think we are as doctors. If we're going to be our best, we have to continually keep trying to learn and get good continuing education. I mean, there's plenty of continuing education that people take in their different respective fields, and it is not good. I feel like what the diploma program puts out is some of the best, knowledge that we see coming out. Even in the last portion of my diploma for the theoretical exam, you have to go back and clinically look at different types of classification systems and what the literature is saying about how to treat. And as I was doing that, it was just amazing to see validated that McKenzie checks all those boxes, and now even where they're going with the psychosocial aspects, and they've been on that, but now the literature's recognizing their work in that portion of the field. It's amazing. So I guess I would say be patient. And when you get that moment in your life to do it because you owe a duty to your patients to have that kind of knowledge. And I think we need to move the ball forward on how we treat musculoskeletal pain. To Julie's, part on how she's saying she's seeing students come out who don't know how to treat. When I got out, we can all say we didn't know how to treat as effectively. So be patient and keep an open mind and consider doing it. It's going to be scary, but it's going to be the best thing you can do probably clinically, in my opinion.
Paco, other thoughts on that question?
Yeah, my advice would be to take your time to go through it, take time to practice NBT in your clinical life before going through all the levels, I think it took me 4 years after the certification to start a diploma program. And I was working every day with 35 people, Diplomates. So I had the chance to have all this experience. But the fact that I could see all the mistakes I could make and how I could already improve with the knowledge I had with the certification gave me even more abilities to improve and to learn more when I was doing the diploma course. And as Adam and Julie said, I think practically for the diploma, you really have to organize your life to do at least the theoretical part. Because for me, I was too busy and I couldn't really enjoy it. I was kind of lucky because it happened during the lockdown. So I didn't have to work at the same time and I was at home, but I was organizing a congress at the same time. And I was really busy with other things. And because of the lockdown, we had to cancel the congress, but we turned it into an online congress. Maybe you've heard about it. Some people from overseas also sign up afterwards. But so the fact that I didn't have all the necessary time to really get involved in the theoretical part was a bit frustrating sometimes because there's so much things to learn. And also from the article you will read, but also from the exchange you have with the other participants. And take your time and take some time.
Yeah.
I don't know if it was clear.
No, it's good advice. Julie, what would you tell the Julie who knew nothing several years ago?
Yeah, I would say do it. It's scary, but please do it. Breathe and just know that everything will fall into place. So the frustration that you feel through the theoretic part, it'll all come into place and it'll all make sense. But it's a hard journey. But as Adam says, it gives us so much more. It's worth it. So yeah, breathe and trust the process.
Yeah. What's one clinical nugget that you can share that you see yourself doing distinctly through the process of having learned it through the diploma program? Julie?
Yeah, I don't know.
Help her
I
out.
have to think about what I've done today.
Yeah, go ahead, Adam.
But no,
I think just pulling back sometimes what I do is I look at the sheet after I have gone through my initial intake. We all have, our initial kind of clinical thoughts and what we're looking at, here. I like to do kind of like a self-audit where I sit there and I look at the sheet and I'm like, okay, what do I really have to do here today to get the best expectations or get the best, and sometimes I do it after the first visit. Did everything, correlate with what the patient was telling me? Did everything correlate with what my instructions were? What did I give them truly the best advice? And coming back and looking at it, making sure that I'm not just trying to seek to destroy the derangement. I'm looking to understand the patient is the big thing, is the clinical take home that I feel like now I'm doing more. I'm not just, trying to put them in a box and classify them. I'm trying to understand them a little bit more, make sure that, we're telling them to avoid certain things that are probably re-deranging. If it is a derangement, not just looking at those things and then trying to find how I can best support the patient. That's the main thing that you take home. I had a patient just this past week who's a single mother who has, 2 kids at home, and wasn't able to get to her exercises. And, I could have been, oh, how could you not do the work that I told you to do? But now we're talking about like trying to have the older kid help out, with certain things and plans so she can get to doing what she needs to do and understanding what barriers or obstacles are in her way. Mm-hmm. And I think that is, given me a skill to kind of take a look back, make sure I'm seeing everything that I should be seeing, and then progressing from there.
Yeah. So, Julie, I may have cut you off. You had a thought, maybe.
I always go in with a plan now. So before I see the patient or call them in, I'm like, so what do I do if they're better? What do I do if they're worse? And what do I do if it's the same? Mm-hmm. So before I wouldn't have any plan. I would just listen to what they're saying and go from there. But now I actually have a plan. So I'm more at ease in my head. What could be the reasons for this? It makes it easier to move on and makes it easier to help them out. So always have a plan.
Excellent. Yeah. Thanks, Julie. Paco, you're the one that's.
Yeah. I also do the same. The plan before the second session or the follow-up. Just like think of it, how will it be if it's better, if it's green, yellow, or red. And the other thing also I added at the end of the first part of the sheet, I added all the different classification. And so I really take my time at the end of the interview to really rule out the one that I'm sure they're not, I can rule them out. So it's also helped me then to focus more on the physical exam than to know, okay, this person, like, it's quite sure, or it's a derangement, or it's a neurose. So I really have to be very, very thorough in my physical exam. Or if there are very, very, very few chances that it's a derangement and something like that could really like flare up, I would take way more time and could be way more progressive in the loading. So this helped me a lot then to improve my physical examination. Mm-hmm. And also I think I really improved in communication. Like really improve in to get the therapeutic alliance. So it also helped me a lot with my patients to prescribe them exercise. And I have the impression they do them. And so yeah, it helped a lot also to see the results when they come back. Okay, I've done the exercise, doesn't work. Okay, so I can go through the next level or rule out the derangement and so on. Okay, it's not mechanical. It's a treatment that the person will need. So,
yeah, great advice, guys. Congratulations on this huge achievement. Thanks for demanding more from yourself and for your patients. We appreciate you guys joining us to help us kind of get your perspective on the diploma program. Adam, Paco, Julie, thanks so much for joining the podcast today.
You're welcome.
Yeah.
Okay. Absolutely.
Okay, so there you go with episode 393. Thanks to Julie, Paco, and Adam. Some recurring themes of what prompted these three to pursue this achievement. At the root, to be a better clinician for their patients. And they chose the MDT diploma program instead of others because the system just made sense and seemed better for diagnosing and to direct treatment. Stay tuned to catch my conversation with my classmates as we're about midway through the theoretical component coming up on future episodes. How we're adjusting to our approach to this workload, how we're managing getting through the material, and juggling our own work and personal life in the process. Be sure to subscribe to my email updates to be notified of new episodes. Subscribe to the podcast on your favorite podcast player and my other social media channels, as we'll be notifying you when each episode comes out. Again, we want to thank today's sponsor, the McKenzie Institute International, providing worldwide training and support to clinicians in the principles and practice of the McKenzie method for the management of patients with spinal and extremity disorders. The McKenzie Institute Diploma program provides the highest level of MDT training. It enables clinicians to acquire an in-depth understanding of the McKenzie method and become experts in its effective use in guiding their patients to achieve their personal goals. If you have an interest in learning more about the diploma program, check it out at McKenzieInstitute.org. And don't forget, we're continuing to plug away here at Mechanical Care Forum with new cases within Case Conversations, our patient case discussion resource, and new studies and papers within Inside the Science, our scientific paper summary and discussion resource. These are intended to provide some virtual mentoring for you and help keep you moving forward in your professional development. You can check out these resources at mechanicalcareforum.com. All right, I wish you a great week with your patients this week. Pull back, do a self-audit of your challenging patients. Go in with a plan and breathe. And join us right back here next week for more from season 13 and more, sharing experience for improved patient care.